Now that we moved our clocks forward an hour, medical experts say your health might be at risk if you don't adjust your schedule and sleeping habits this week.
Especially for those who are already suffering from some sort of sleep disorder. Couple that with the time change, it can be difficult to operate a vehicle, putting others in danger. Alex Love spoke to URMC doctors and a spokesperson with AAA. He joins us in the studio with that story. Alex.
Yes, absolutely. Especially after we lost an hour, doctors advise grown adults should be getting at least 7 to 9 hours of sleep each night to stay healthy. But losing an extra hour on top of any lack of sleep you already face not only keeps you tired all day, it can weaken your body's immune system. Even though the sun stays up later in the day, doctors who specialize in sleep disorder warn taking off 1 hour from your sleep schedule with no adjustments can make the public's health suffer.
We know that people that have poor sleep have a high risk of heart disease and stroke and even diabetes. Does that 1 week, play a role? We don't think so, but when you look at billions of people, when you're screwing around with their time schedule, will it have that effect? That's the concern.
Keeping a healthy diet is one way to make sure your body gets back on a healthy sleep schedule. But doctors also urge you to give yourself time before bed to decompress and try to be asleep within 15 minutes of laying down.
You're in bed just for sleep. That's it. You're not looking at the computer. You're not staring at your phone. It's not dinging on the sideline. You're not watching TV. You're not doing work in bed. Bed is for sleep. That is what it's for, and that's it.
Research from AAA found red flags for being sleep deprived include having trouble keeping your eyes open and not remembering what you've been doing the past few minutes. But drivers they surveyed experiencing this downplayed these symptoms.
A quarter of those people who fit that description had their eyes closed for at least 15 seconds in the span of a minute, told the evaluators that they were just a little bit drowsy. And that's the concern.
Doctors and AAA agree this combination can lead to an increase in car accidents this time of year. To prevent crashes, AAA encourages all drivers to only travel when they're normally awake and take a break every 2 hours or 100 miles.
Before you start driving, make sure you got at least 7 hours of sleep under your belt. The other thing is you want to avoid heavy foods, right? Because that can make you sluggish. You want to avoid medication that might make you drowsy behind the wheel. Resist that urge to keep driving.
That survey from AAA also found 75% of drivers experiencing moderate or severe levels of drowsiness on the road only rated it was low to them. If you're experiencing sleep disorders, you can see where you can go for medical help by visiting rochesterfirst.com. Teresa?
Thank you, Alex. There was federal legislation which would have made daylight saving time permanent this year by getting rid of the practice of setting clocks back 1 hour in the fall. That year would have been on November 5th, but that legislation did not pass Congress. You can read all about that bill over on our website, rochesterfirst.com.